What I want to talk about is how we replace missing teeth with dental implants. Now, dental implants have been around for more than 40 years now, so it's a very proven method of replacing teeth. So what I'd like to do is show a schematic of how this is done. So we're going to focus on this area of a missing tooth on the lower jaw. And what we're going to look at is a cross section of that area. So this is the jaw bone that we all have. So your cheek's basically sitting on this side and your tongue sitting on this side of this bone. So the first thing we do is we prepare a very small channel in the bone. And then what we do is we use a dental implant. These come in various sizes and widths and lengths, so every patient gets one specific for their use. The important thing with a dental implant is that they have threads that engage the bone, but they also have a surface that eventually forms an actual chemical bond to the jawbone, so it gives it a lot of stability. So the implant is placed. And then it takes anywhere, depending on the case, anywhere from 6 weeks to 3 months for the jawbone and the implant to fuse together. And then at that time, an impression is taken of this area, and what we make is something called a crown, which is actually the part of the tooth that you chew with. That's secured to the implant with a small screw right through the middle part of it. But when everything is done, this is the only thing you see. You don't see any part of the implant or the screw or anything like that. So it acts and functions like your own natural tooth. And when it's done properly, it's very difficult to tell that if it's a natural tooth or a dental implant. This is a model of a dental implant. As you can see, it has threads, and that's what engages the bone and gives the implant its initial stability. And then once it's stable, then a crown is made that gets connected to the implant either through the use of something called an abutment, or most often it has a screw that goes right through this that connects it to the implant. So an actual implant is typically this size, so it's not super big as those models are.